Hey Beauty Besties, NP Kristen here to chat with you today about Pdo Threads. So, what are Pdo Threads? Well, Pdo Threads stand for polydioxanane. This is essentially an absorbable suture. This is the same substance that has been utilized in operating rooms across the country for decades now. Our bodies are well acclimated to this and have no issue in breaking this suture down. In the aesthetic world, as these sutures break down, they actually help stimulate collagen. So these are collagen stimulating little threads that are placed under the surface of the skin to reposition tissues. And as the thread dissolves, it leaves a collagen scaffolding in that area that helps provide long-lasting thread results. Pdo threads are a non-surgical option to help reposition tissues for those that are not quite ready for a facelift. Maybe you don't want to go under the knife. Maybe you have issues with anesthesia, and maybe you just don't want to pay the astronomical price of a facelift. This will not substitute for a facelift. I would not call it a facelift alternative. However, it is something that you can do in office that provides results similar to a facelift, in that we are able to reposition tissues to how they looked prior a few years ago. So, how do threads work? Well, they are actually little dissolvable sutures that have little tiny barbs etched into the thread material. We're going to create a pilot hole in a discrete area. We're going to numb that, and we're going to insert the thread subdermally under the skin to the desired endpoint, and then we're going to engage the thread. As we lift up, we are engaging the thread, ensuring that the thread is grabbing hold to that dermal tissue. Once we ensure that happens, we're able to lock those threads in place, giving you a nice lifted appearance. Then, over time, these threads are going to stimulate collagen and dissolve. So these results are not permanent, but they are pretty long lasting. Typical results are going to last about 12 to 15 months, as it does take the body about 12 months to break down collagen. We lose 1% of our collagen reservoir yearly. Fun fact. So when will I see results? Well, instant gratification is what we love, and instant gratification is what Pdo Threads deliver. You're going to leave that day snatched. Your face is going to be tight and lifted. I do find, though, that it does take a nice 2 to 3 weeks for everything to settle. Inflammation needs to go down, and the threads need a little bit of time to integrate into the tissue. So although you're going to be nice and snatched at the time you leave, there may be some issues where you're just a little bit like too tight in some areas. Those resolve over the next 2 to 3 weeks as everything is integrating into the tissues and doing its thing. Is there any downtime? Not really. And this is a reason why a lot of patients opt for thread procedures over a facelift procedure. A, it's non-surgical. B, the downtime is far less. Really, your only restriction is activity. You just don't want to be out hitting PRs, doing heavy lifting in the days following your thread procedure, because these threads are sensitive. They're taking time to integrate into the tissue. We don't want to exert too much force. We don't want to go and eat really big cheeseburgers, big chewy steaks. We want to take it easy and eating softer foods and just gentle exercise for the days following our thread procedure, just to ensure that we don't break any threads or cause any harm to ourselves. Is this procedure painful? Well, it's not for the faint of heart. I do find it's much easier for gals that have done Botox and fillers and lasers before. If you're new to the aesthetic world, I'm always going to recommend that we do some treatments prior. However, at Monarch Beauty Aesthetics, we have a wide array of comfort modalities for you. We have Pronox, which is a 50-50 blend of nitrous and oxygen. This is a patient-controlled laughing gas that just helps you relax during the procedure. We have distraction tools, as well as we utilize Pdo Max threads, and they come with a numbing cannula. This is major. I've done threads without and with, and patients as well, and everybody astronomically loves getting numbed first under the surface with the numbing cannulas. So all of these things together really make this a tolerable procedure. So who is a candidate for Pdo Threads? I find that it takes a little bit of prep work to get a patient ready for threads to give them the best result possible. If you go to a provider who just looks at you and says, let's do it, they don't even do a consult with you, I would be hesitant. You definitely want to visit a provider that prioritizes skin health and also looks at areas that we may need to revolumize or areas that we may need to reduce with fat dissolval. Reason being is that threads are weight sensitive. If we are trying to work on areas that have a lot of excess fat, it may be more beneficial to dissolve those areas first. On the contrary, if we have someone that has too much skin laxity, we will have unsatisfactory results with our threads, as there won't be anywhere for that excess skin to go, okay, because we're not cutting on it. Remember, this is not a surgical procedure, so there's nowhere for the skin to go, as we're not actually cutting skin. We're just repositioning skin. So if you're somebody that's dealing with a lot of skin laxity, we definitely are going to start you on some medical grade skincare, a radiofrequency microneedling series, as this really helps boost collagen and elastin in the skin, and it targets skin laxity. And if you have too much submental fullness, jowl fullness, we're definitely going to look at reducing that with fat dissolval. We may need to do some Botox in areas. We may need to Botox the platysmal bands in the neck if we're treating the neck to help reduce those fibrous bands as we're going through with the thread. And then if there's areas that have a lot of volume loss, we need to look at filling those areas with volume first, as if we don't and we just add threads, they can just accentuate those areas that have lost volume. Because of all these factors, I do not let patients schedule Pdo Threads online. We only book Pdo Threads by consult only. So if you are interested in this procedure and coming to see me, you can visit us online at www.monarchbeautychat.com, or you can give us a call or a text at 423-788-2042, where my sweet office manager, Marissa, will get you on the schedule for a Pdo Thread consult. We'll go over all the things. We will discuss pricing at that time, and we'll get you scheduled for your procedure. So hope this was helpful. I'm in for Kristen. Hope to see y'all soon. Bye.